You're most welcome. May the peace and blessings of God the Almighty be with you all. Hello, Health Check viewer. It's your program once again, airing on your screens. It's been a while since you last saw us on your screen, but we're back again by God's grace. How are you doing? Hope you're well by Allah's immense grace. I can define health as being free from any sorts of ailments, be it physical, mental, or in any other way. So you must be free from any sorts of ailment for you to be healthy. And this is why we bring doctors from different locations of the world to help us understand how we can cope with the well-being of our health. And today we are tackling ailments regarding the sight of a human being. And the disease that we are tampering with today is Onchocerciasis. I have a doctor from Mbale. Those are around 230 kilometers from where we are stationed. So he traveled to come and give us help to see how we can understand, identify, and cope with Onchocerciasis. What it is Dr. Kiseru Geoffrey Herbert that is going to help us understand what it is. Doctor, most welcome.
Thank you so much, sir. I'm glad to be here.
Thank you so much.
Thank you for having me.
Thank you for sacrificing your time. Just like we've been doing, it has been a norm that we have more doctors, one of which has not managed to be with us, but is online and is following. Inshallah, we shall invite him in also, and will be helping us with understanding the facts about onchocerciasis as well. That is Dr. Ambrose Wekwanya, also an eye specialist. So his online will be following, and we shall invite him in when his time comes in. Doctor.
Yes, sir.
Now I turn to you.
Yes, sir.
Onchocerciasis,
yes,
the topic of discussion today.
Yes.
It's the term that I personally do not understand, and I believe a lot of people outside there do not know what onchocerciasis is.
Yes, that is right. Onchocerciasis is an infection, and is a parasitic infection. Like any other parasites, those worm infestations and infections that happen in human beings, this onchocerciasis is one of those infections that comes from these worms. And as we know, parasites, they have a host, and their host is a human being. They have other hosts, but the definitive host, or the host in which this organism that causes this disease that we call onchocerciasis grows up and matures only in a human being. That's why the infection is also very rampant in human beings. So onchocerciasis is an infection caused by a worm, which is called Onchocerca volvulus, which, from which that term onchocerciasis has come, because of the agent that is causing the disease called Onchocerca volvulus. That's why we get onchocerciasis, meaning infection by this organism called Onchocerca volvulus.
Yes. Doctor,
yes, sir.
Onchocerciasis, briefly you have explained to us what it is, what brings about this, the virus, you've already explained that. And allow me call in my brother, Dr. Ambrose Wekwanya, to give us some facts regarding onchocerciasis. Dr. Ambrose, this is the time we've been waiting for. This is the time we had to call you in. It wasn't far from the beginning or from the commencement of our program. So we would like you to help us know or take our viewers through some facts about onchocerciasis. Dr. Ambrose.
Greetings to you all, our dear viewers. You are welcome to this video. I'm called Wekwanya Ambrose, an eye specialist, specifically an ophthalmic clinical officer. And today we are going to share about a disease called onchocerciasis. Onchocerciasis is a very common disease that is also most times being called river blindness. It is being caused by a parasitic worm called Onchocerca volvulus. It is being transmitted to human beings by repeated exposures to bites of a black fly that always stays in rivers. It is being characterized by severe body itching, also involves a visual impairment, and at times it complicates to permanent loss of vision. More than 99% of the infected people stay within the 31 African countries, of which it also involves East African countries like Uganda, Kenya, and Tanzania. It also involves other countries in Latin America. So globally, the burden of the disease, there was already a study which was done in 2017, whereby around 220 million people by that time needed a preventive chemotherapy against this disease called onchocerciasis. Around 14.6 million people had already skin itching or skin-related diseases, and around 1.15 million people had already vision loss because of onchocerciasis. Basing on that, World Health Organization was able to recommend what we call a population-based treatment with ivermectin, whereby was being distributed to all the people as one of the core strategies to eliminate onchocerciasis. So thank you so much. I remain Wekwanya Ambrose, an ophthalmic clinical officer. Thank you.
Thank you so much, Dr. Ambrose. Our viewer, I hope you are now well versed with onchocerciasis just at the beginning of our program, and I hope you are entertained already, or you are picking a few things in as far as understanding this ailment is concerned.
Yes,
Doctor?
sir. Yes, sir.
From his explanations,
yes,
we can see that onchocerciasis, not only does it appear in men, but in women as well.
Oh, yes.
How do women get contact with this, get into contact with the onchocerciasis?
Yeah, so onchocerciasis, like Dr. Ambrose has explained, it is a rampant disease affecting about 1.8 million people worldwide, and specifically, and also most commonly occurring in this African continent, especially sub-Saharan Africa, West and East. So how do people get exposed to this infection, onchocerciasis? Yeah, the onchocerciasis is carried, the Onchocerca volvulus, the worm that causes the condition, is carried by a fly called a black fly.
Okay.
And this black fly breeds along fast-flowing rivers. Okay. So that's why most people that are infected are the ones that are along rivers.
On the riverbanks. Yeah.
Yes, that also explains its other name, river blindness.
Okay, that's the other name.
That is the other name.
River blindness.
River blindness.
So don't be confused, our viewer, when you find such a name elsewhere. River blindness is the same as onchocerciasis. Okay, please.
That is right. Yes, so this black fly is the one that carries the worm. So the worm migrates and goes in the proboscis, and when it bites you, it transfers the worm into your system.
Okay.
Now the worm goes and settles under the subcutaneous tissue, under the skin. When it settles under the skin, it grows into maturity. When it grows into maturity, that's when it produces a million of smaller other worms, which we call microfilarial worms.
Micro, that means they cannot even be seen with our eyes.
Exactly, and there are in millions of them.
Okay.
And these small worms go and invade all the other tissues in the body, including the eyes. That's why it is an eye specialist that is here.
Okay.
It affects the skin, yes, which is the most common actually symptom. A person will have an itchy skin, very severe itching, after it has settled under the subcutaneous, under the skin. Then after it reaches its maturity, it produces millions of these small worms. And these small worms go to other tissues of the body, including inside the eye.
Doctor, this now brings me to you have taught us or told us some of the causes, but we need to have more of them and the risk factors that come with these problems regarding onchocerciasis.
That is right. So some of the risk factors, one is living in an endemic area. Endemic area means that you are living in a place where this disease is mostly occurring. That means if you are far away from where the disease is mostly occurring, you might not be at risk of getting the infection. Okay. But if you are living in an area where this disease mostly occurs, like in some of the endemic areas we have in Uganda, like Kitgum or Yam, those areas are endemic of onchocerciasis. Okay. That means if you visited the place, you might as well get infected with onchocerciasis. Yeah, so that is one of the risk factors. Another risk factor is living in this African continent because it is endemic here.
Okay.
Yes, so those are some of the risk factors of getting onchocerciasis.
Okay.
Unfortunately, it does not spread from human being to human being.
Okay.
Yeah, but spreads by a bite of a black fly.
Is that unfortunate or fortunate?
It is fortunate, actually.
Yes, it is. It's fortunate.
It is fortunate. It cannot be. You cannot get it from your friend. However, if the black fly bites them, and that black fly becomes infected and bites me as well, I can get the condition.
Okay.
Yes.
Thank you so much, Doctor. Indeed, I'm enjoying the program. And I hope you are as well, our viewers. This is for you. This is not for me alone. I'm just representing you, but it is for you specifically. You need to understand this. But in case we give you advice or our experts give you any advice, and you find that the symptoms that they have advised you about persist, you need to go and visit your own medical experts, and please, before you take our advice, consult your medical experts as well. Every person needs to have one, I guess. Doctor, this brings me to the complications that comes with onchocerciasis.
Yes, complications that come with onchocerciasis, there are quite many, but obviously because it is dwelling under the skin. Now, what happens when these millions of small worms that I talked about are spread all over the body in different tissues? Okay. When they die, they release toxins. These toxins are the ones that cause the symptoms. Those toxins are very toxic to the tissues of the body. So when it dies in an area where it has died, it will form a blister, and it is very itchy.
And what is a blister?
A kind of swelling which eventually can become a wound.
Okay.
Yeah, so because it is very itchy, they tend to scratch them. It is very psychologically disturbing, a disease. Some people might call it witchcraft and all those
most
sorts of things.
especially in our African communities.
Exactly. So a person has that itching that is so severe. And then also, as these worms migrate to different tissues of the body, they might also find their way into the eyes. And when they go into the eyes, they affect especially the back part of the eye, the retina. Okay? So because these worms are dwelling there, and if it dies, it releases toxins, which damage the part where it has died. So unfortunately, this damage can lead to blindness. So these are some of the complications. Yeah. So a person can go under depression because of the condition. Two, the person can turn blind because of the worms that are inside the eyes.
Is that blindness permanent?
Yes, it is irreversible blindness. It is irreversible blindness because the damage can really be permanent. The damage at the back of the eye might not be reversed.
Okay.
Yeah. But we can control the effect.
Worse.
Yes. Okay. Exactly.
Thank you so much, Doctor. Indeed, it is risk. In the beginning, I thought it is something that can be played with and be gotten rid of easily, but it seems when you delay and sit behind as you watch it grow, it becomes a very, very big and unfightable or defeatable complication or disease. Doctor, now this brings me to the symptoms. You've taught us of the itching of the skin. That is one of the symptoms that I've identified from your explanations. We need to know more of them.
Yes.
How does one know that? Because we are specifically now discussing about the eye. Okay. With the skin, a number of diseases can be itching. Okay.
Yes.
A number of them. But how does one get to know that if I see such and such a sign, maybe I'm contracting or I'm getting onchocerciasis very soon? Okay.
So the first symptom that normally happens is the itching.
Okay.
Yeah. Normally, the adult worm, when it is inside your system or under the skin, it will form, where it has settled, there will be a bump or a swelling.
Okay.
That's where the adult worm will be. So even swellings on the skin, they can, especially on the trunk area and the thighs, the back, if you find such swellings, bumps on the body, you might need to think about onchocerciasis.
Okay.
Yes, and after it might result into severe itching.
Okay.
Very severe itching, forming wounds, and the wounds, of course, when they heal, they leave a big scar, which is not a good thing. Yeah. So even there's loss of hair, loss of skin, a very bad thing. And when it comes to the eye, when damages come to the eye, most of them are even permanent, because where it has damaged, where it has moved and died, it releases a toxin that burns that area and causes irreversible blindness. Okay. So when you see such bumps on your skin and then your vision is also deteriorating, think of onchocerciasis and seek for medical help as soon as possible.
Okay.
Yes. The challenge that we have in our community is we have poor health-seeking behaviors. People wait for the last stage of the disease. That's when they will show up in the hospital. Yeah. But come early. Once you have the bumps, you see itchy skin, the vision is deteriorating, run very fast. The psychosocial effects are indeed very big implications on the person's health. Okay. Because when a person sees you with patchy skin, with bumps on your skin, itching every time, sometimes they are stigmatized. They say, I think you have a bad infection. They might regard them, maybe you have HIV, maybe this is witchcraft. So a person might pull out of the community, feel depressed, and feel alone if they're not helped. So socially, the person, they can actually even isolate you, thinking that you'll infect them, you'll spread the disease to them. So socially, the person will have very negative effects on their lives. Okay. Even the family can choose to close them in one room and leave them there, thinking that the infection will spread to the other members of the family, which is not a good thing. This infection cannot spread from human to human. However, it is spread by black fly. Okay. Yes. So socially, the person will not be fine. Okay. Socially, the person will not be fine. And of course, psychologically, if you are isolated, definitely you don't feel fine. Yeah, that's why they go under depression. So you find most of these people need rehabilitation, need counseling and treatment.
Now this brings me to a question.
Yes.
That is in line with psychosocial effects. Yes. I mean, what can work as a help or assistance to such people? Let's assume someone has already contracted the virus, someone is already sick. Remember, they have realized that at a later stage where it is almost uncontrollable. How does one cope with onchocerciasis?
Yes. First of all, the person needs to get treatment. We need to kill these worms. Yes. And after these worms are dead and are out of the system, now we deal with the complications. Some of the complications can be blindness. Okay. You train the person how to live with their blindness. Rehabilitation. Train them how to walk with a walking cane. Okay. Maybe if they still have some vision, you train them how to use the little vision that they still have to use their life profitably. Okay. These are some of the social problems that they get after the complications set in. Okay. The person might not go back to dig like they used to. Person might not go back to their occupation that they used to.
Might not go back to driving as they used to.
Yes, driving like they used to. So they need to be rehabilitated, counseled, and also trained how to use now their bodies in an important way. Different blind people are doing different things. Okay. Others are taught how to read using their fingers, braille. Others are taught how to use different objects and other things, computers, their phones, such that the person is socially still connected with other people, not be isolated because of the complication. So it is very important to rehabilitate these people, and also teaching the community. We have to go down and do mass health education, train people, teach them, and tell them when this happens, don't isolate the person, support the person. And when the person has this condition, what do you do?
Don't make them feel lonely.
Yes, and what do you do? Bring the person to the hospital. And what should we do? Let us all get treatment. Let us provide treatment. There is some treatment. There used to be mass distribution of treatment in the earlier years. When
talking about treatment, doctor,
yes.
You reached a stage where you said that it might reach a stage where it is almost irreversible. Yes. Like, for instance, one gets blind of onchocerciasis, it is never irreversible. He'll never regain their sight, or they will never regain their sight again. Talk about some treatments, measures you use when you realize that maybe such and such a person has contacted or gotten onchocerciasis at a stage where it is treatable. Talk about those those treatments.
Yes, the treatment, first of all, it can be medical and can also be social treatment.
Okay.
Medical meaning we shall give the person drugs to use such that the condition goes away. For example, there's a common drug that was massively distributed in the earlier years when the incidence of the disease was higher, ivermectin, and also spraying the black flies. They used to put DDT, a certain chemical, in the water such that the black flies die and don't infect the people, and also give treatment at least a year. They could do a mass distribution of treatment to everyone in the endemic areas. You swallow in case you have any worm in there, it dies.
Okay.
In those years, actually, people would go to the toilet and produce real live worms coming out. Yeah. So we can rehabilitate also, part of treatment, rehabilitation. You treat by rehabilitating this person, you train them how to use their life now that maybe they have turned blind, or maybe they are partially blind. There are some vision aids that they can use, hand magnifiers, such that the person might not see well, but if they put a magnifier on, they might be able still be able to read, a walking cane, such that they can still ambulate, move around, and do their day-to-day activities. And mass training or teaching, health education, is part of treatment. Yeah, when you health educate people, they will get the knowledge and they will know what to do always.
Okay.
Yeah, so going down in the communities, even part of what we are doing here on TV, if people watch the TV, they will learn. And when they learn, they will teach others also. And the problem is half solved, actually, because people will know that I need to go to the hospital, I need to do this is what I need to do. So even mass health education is important, not only here on television, but also in schools, down in the communities, in village meetings. We need to give health education such that people come to terms with the condition, especially in the endemic areas. Yes.
Thank you so much, Doctor. Our viewer, I hope you are enjoying as we proceed with our program. I hope in the course you are learning and noting a few of the advice that our doctor is giving us. Our brothers, for those that for those that have already gotten onchocerciasis, please, this is not the end of life. Doctor has already told you there are steps that you can take from your medical experts, your medical personnel, that you can take and learn how to live with the ailment. For those that have not gotten it at a later stage, you can still you can get rid of the disease. This is according to the information that I'm getting from the doctor. In case you see an itching skin is persistent, you've got some swollen spots from your skin, please rush to the doctors before the situation worsens. Doctor.
Yes, sir.
We are at the evening of our program.
Meaning
we are almost closing up the program. But before I do,
yes, sir,
do you have any concluding remarks to our viewer before we sign out?
Oh, yes, thank you very much. Now, most importantly, let us seek medical advice always. You know, traditionally, Africans, you want to think about witchcraft and all other things, traditional medicines. Some of the traditional medicines actually bring more harm than good.
Okay.
Some people literally put funny medicines in their eyes. So do not use traditional eye medicine in search. Seek health advice early enough. Having a routine eye check is not a bad thing. At least once every year, every one of us needs to have a routine eye check at least once a year. Find where an eye hospital is or an eye clinic where the eye specialists, health professionals that can do a comprehensive eye checkup. Some of the diseases that actually cause blindness might never cause any pain, any itching, any symptom. But later on, you might find yourself blind. And the condition began maybe 2 or 3 years ago. So having an eye check at least once every year, everyone, that one it should be everyone's mandate, everyone's thing to do. At least every year, it should be part of your program. Okay. Because some of the problems that we are facing in Africa is poor health-seeking behaviors. Yes. People always come to hospital late. Something that would have been tackled early, person comes when complications have set in, and some of the complications are irreversible, like blindness. You might not reverse it. Thank you.
Thank you so much, Doctor. Thank you so much, Dr. Herbert. This has been Dr. Herbert for you. He traveled 230 kilometers to come and give you this information. We thank you so much, Doctor. Please, next time you see our call, calling you to come and give us an assistance, please do. Do not hesitate to come and give us a hand in helping our viewer outside there. I'm going to remind you that prevention is cheaper and curing is more expensive. So prevention is better than cure. So you better find methods of not contracting this virus because it has symptoms or some ailments that are irreversible, just like you've heard from Dr. Herbert. Unfortunately, like I've been telling you always, we failed to make a good relationship with time. And time is calling us off. I can't go beyond this. Until we meet next time, inshallah, let's meet and health check again. When you see it on your program, on your TV station, same time, same day, inshallah. Assalamu alaikum wa rahmatullahi wa barakatuh.